I'm Dan Weigel, Vice President of Corporate and Government Affairs for AstraZeneca. If you're not familiar with AstraZeneca, we're a global, science-led, patient-focused pharmaceutical company dedicated to transform the future of healthcare by unlocking the power of what science can do for people, society, and the planet. As you know too well, climate crisis is the largest public health crisis of our time. But what's ironic is the healthcare sector, a sector that works to keep the health of patients, also contributes significantly to the greenhouse gas emissions. Climate change is increasing the levels of ill health and jeopardizing access to basic healthcare needs. It's incumbent that we act together on these interconnected issues, as we cannot do this alone, and forums like we're in today are essential to the path forward. Yesterday, AstraZeneca hosted a roundtable discussion with the National Academy of Medicine to discuss the needs to have a fundamental shift from caring for sick patients to healthy patients, essentially creating green patients. And in doing so, enable early intervention, early action, better outcomes, and less impact to the environment that we care so much about. We also discuss how we can enable the acceleration of the healthcare sector's decarbonization journey, while at the same time ensuring the healthcare system can evolve to meet the needs of patients around the world. Today's panel, focusing on how healthcare can heal the people and the planet, further adds to this discussion, and I'm quite eager to hear the comments and the thoughts from the panel. Speaking of the esteemed panel, please allow me to introduce them. Dr. Gaurav Basu, Assistant Professor, Harvard Medical School, Harvard T.H. Chan School of Public Health, Director of Education and Policy, Harvard Chan School of Public Health, C-Change. Dr. Julio Frank, President of University of Miami. Dr. Cheryl Holder, Associate Professor and Retired Associate Dean for Diversity, Equity, Inclusion, and Community Initiatives, Herbert Wesleyan College of Medicine, Florida International University. Elizabeth Joseph, Nurse Practitioner, Jackson Health System. So with that, I'd now like to turn it over to today's moderator for the discussion, Emmy Mediate, Chief Program Officer, Healthcare Without Harm. Thank you so much.
Thank you so much, Dan, and thank you to all of you for joining for this conversation. My name is Emmy Mediate, and I am with Healthcare Without Harm and Practice Green Health. We're an organization working with the healthcare sector to realize a net zero, more resilient, and more equitable healthcare future around the world. Before I get us started with the panel, I want to just give some grounding kind of context, and especially for folks who might be newer in the room to some of the context that Dan provided about the healthcare sector's role in the climate crisis. So I'm going to direct your attention just to the slides up here as I sort of give us some opening context. So we know that climate change influences human health and disease in numerous ways. I probably don't need to tell all of you that. You might have experienced it yourself, or folks in your community or your family may have directly experienced the impacts of climate change themselves. The way that this works is ecological system disruptions are increasing greenhouse gas emissions, which lead to particular conditions. And those conditions, extreme heat, for instance, floods, extreme weather, air pollution, are leading to myriad health effects, right? We're seeing increased morbidity, mortality. We're seeing a number of exacerbations of chronic disease, injuries, fatalities, a number of impacts. And those health impacts of climate change are unequal in their reach, as we know. What folks, might not realize, or the connections folks might not draw, is that this interconnection between climate, health, and equity, the healthcare sector is on the front lines of treating those that are impacted by climate change, right? They're the folks who are in the emergency department seeing patients who are coming in suffering from, some conditions that are exacerbated or caused by extreme heat, or in the aftermath of a hurricane, they're treating patients, seeing patients who are impacted by climate change. What we might not realize is that at the same time, as Dan pointed out, there's an ironic role, and we can go to the next slide here. There's an ironic role that the healthcare sector is playing in the climate crisis. Its operations are actually contributing significantly to climate change, harming the very patients in the community that they are seeking to heal. And you can see here, if the global healthcare sector were a country, it would actually be the 5th largest greenhouse gas emitter on the planet. It's pretty astounding, right? We think about all of the different country emissions and breaking it down by sector. It's pretty significant. In the US alone, for US emissions, the healthcare sector is responsible for 8.5%. Really significant. So we don't often think about that role of the healthcare sector, but I like to see it as an opportunity, right? The healthcare sector has this opportunity to do good on its healing mission, to make sure its commitment to do no harm is really lived through by radically reducing its own emissions and continuing to treat the patients that they serve. We can go to the next slide here. There's a graphic that breaks down emissions. This is more for my climate folks in the audience, just to see, I mentioned that 8.5% statistic that's pretty compelling. This breaks down that 8.5% and shows where are those emissions from the healthcare sector coming from, right? What sources? We see here scope 3, probably not surprising, this isn't terribly different from other sectors, is around 82% of emissions, right, of the healthcare sector's footprint. So I just want to ground us in that context as we talk a little bit about the healthcare sector's role. There's sort of this dual piece of addressing its own emissions, quite significant. Its role in producing waste and procurement challenges, and if we all just think back to even the pandemic and how many tests did we all take, how many masks, how many kind of single-use plastic items, right? So even just that, if nothing else, as a way of grounding us. But then also the importance of those on the front lines, those health professionals who are really treating patients who are coming in increasingly with health conditions that are caused or exacerbated by climate change. So with that grounding, I'm going to turn to our panel, and I'm going to invite each of them to really just respond to a question. The experts that we have here on the panel, I'm so excited for you to get to hear from them. We have a rock star set of folks. They're all really steeped in the healthcare space, improving health equity. So I want us to hear from you all. Can you just tell us a little bit about your journey to becoming a climate advocate in addition to your call to health? We'll go down the line and start with Dr. Basu.
Yeah, thanks so much for that framing, Emmy, and for all of your work, and grateful to be with all of you and the panelists today. I'm a primary care doc. I work in a community health center. I'm a global health doctor working abroad and working on issues of global health equity and human rights. Was really what I was seeped in early in my career, working in India and Liberia and working on health equity work facing my patients. And I'll be honest with you that I was not thinking of climate as at the core of all the things I was thinking about until the 2018 IPCC report. So what I'll just say briefly is that was a thunderbolt moment for me. I can remember very clearly waking up and reading that report on a lazy Sunday morning, October 2018, still can remember it. And I remember viscerally kind of shaking, kind of just that report I think was so good at explaining what climate was doing, how quickly it was doing it. And I think the writing, my wife was pregnant at the time, that probably had something to do with it, but I could clearly see that climate was at the middle of everything I cared about as a parent, as a doctor, and it changed my life, it changed my work, and I knew that I had to fundamentally put climate to the middle of my work. So I would say I'm still on my journey of navigating how to be the best advocate I can, but I went through a real process of thinking how to be most effective as a climate advocate, and as we'll talk about today, I think we all would argue that those of us in the health professions work really want to be on the forefront, believe that we need to be at the forefront of communicating the health benefits of climate solutions, and really putting kind of a moral compass on this work and doing that translational work of putting our patients' faces and the public health data at the center of the conversation.
Good afternoon. I also want to thank the Aspen Institute, the city of Miami Beach, AstraZeneca for organizing this session and inviting us for this very timely discussion. Well, I have a larger journey than everybody else in the panel, but I'm not going to speak proportional to the size of my journey. I'm right now president of the University of Miami, but I am originally a physician. And quickly I decided to go into public health. Public health is like medicine, except that society is your patient. All of society is your patient. That's my definition of public health. And therefore, you take into account societal circumstances. You take into account the natural and the built environment in understanding the determination of health and disease in populations. That's what public health does. So I've been doing that both from academia and from public policy. I worked at the World Health Organization at a moment when the director was Dr. Gro Brundtland, the famous Brundtland report that actually is probably the initiation of this journey around climate change, but always understanding the influence that environmental factors have on human health, and realizing that climate change is deeply connected to other forms that derive from the way we humans abuse our planet at the expense of ourselves and of the other species with whom we share that. I became, at some point, the Ministry of Health of Mexico, which is the country I was born and have done most of my work in. And I had an opportunity to emphasize these themes, the nexus between social inequality, poverty, and environmental degradation, and climate change, and what that does to poor communities in particular in a country with large social inequality. And then after being the dean of the School of Public Health at Harvard, I have been here now for 8 years. And the minute I arrived in Miami, I realized I was at ground zero for climate change. I did a very extensive 100-day, my first 100 days, listening to every constituency, not just inside the university, but outside, and everyone. The unanimous message was, the focus of your university has to be around addressing climate change, because we're in Miami, and it is an existential threat for all of humankind, but Miami is like on the front lines. And that's what we've done. We work very extensively on that. We've created a Climate Resilience Academy. Michael Berkowitz, who has been very active, and some of you have heard him during these days, is leading that, and it's marshaling every resource of the university to tackle the question of climate, both from a scientific point of view, from an instructional, a teaching point of view, and from a community action point of view.
Thank you so much. And Dr. Holder, I also just wanted to mention, I know you serve as executive director for Florida Clinicians of Climate Action. We didn't hear that in the introduction. So excited to hear about your journey, but wanted to make sure to mention that important group you're leading.
Thank you. I'm probably the second longest journey, because I thank everyone for being here. I go back, I have to remember the first time I got the real bug from medicine, and I was in a pre-med program, everybody was doing it, but I was 15. I was on the streets of South Jamaica, my first job, and I was doing blood pressure checks and screening and trying to find all the folks who have blood pressures, and I was all excited, but what I got a chance to listen to some stories, and there were mainly older Black women in South Jamaica at the time, and hearing those stories, and I ended up wanting to do primary care, and I worked. And when I finished residency and training, I trained in places where the same stories, much of the same population. And I ended up here as a National Health Service Corps person at Jackson and working in the community. And in those times, you get to build that relationship. And how do I end up doing climate change? Because it's my patients' stories, it's their lives. And so I have been in medicine, it's been one epidemic after another, from HIV. And the stories are very subtle. It's not that somebody knocks me and says, it's too hot, the climate has changed, and my blood pressure is high. No. It's really a compilation of symptoms, findings, where can't pay a bill, my blood pressure is a little bit up. Or most recently, a patient told me, last summer my constipation got so bad, he was an outdoor worker, and his hemorrhoids acted up. So it's a series of harms and oppression and suffering that I experience. And when you do work, which I did with National Medical Association, around environmental injustice and the toxins and the pollution, and I ran school-based health centers here in Miami, and so much asthma and absentees, the days lost. And these are the stories that compiled on top of each other till I have that aha moment where I go, oh my God, it was so hot in 2016. I'd even dabbled in getting some people educated and bringing folks to FIU to teach. I brought Caroline Lewis into FIU in 2015, talk about climate change. But it didn't till my patient clicked in 2016, I'm like, all of this is about the planet. It's about the patient's suffering. It's another pandemic. It's another existential threat that my community is undergoing. And they need a voice. They need somebody to speak up. And they are really weathered. And I came through HIV. I had my voice. I learned how to do it with the HIV pandemic. We're out there doing it. So I used my skill to now saying we must do something, but my patients have a role in this, and they can teach you so much in how to address this climate crisis, because they have weathered many crises. And they're going to do okay for some, but we can teach you a lot. And my voice now is to bring those lessons there to inform this movement so we can get an urgent response. So that's why I'm here. Thank you.
Thank you, Aspen, for bringing healthcare into this conversation. And I think this is the first time we had this opportunity to do this. My journey actually started in rural parts of India when my grandmother used to tell me at a very young age about reusing and recycling and water conservation and energy conservation. At that time, it was the right thing to do. And fast forward, as a young nurse working at the hospital, I used to go around different offices turning off the lights that were not being used, and pestering administrators saying, we really need to support our employees with public transportation. So as I gained knowledge about the health effects and seeing frontline our patients coming in through emergency room with heat stresses, I realized that I really cannot sit back being comfortably numb and not address the situation. Furthermore, healthcare being one of the biggest contributors of carbon emission, I really was an aha moment for me. So we decided, as passionate healthcare professionals, few of us got together along with the union and the hospital administrators, say we need to do something about this. And we formulated a climate committee at our hospital. And as the co-chair for the climate committee and the co-chair for the Alliance of Nurses for Healthy Environment, our mission is to empower nurses and other healthcare professionals to become climate advocates, advocates for our patients, for our community, and also to work our butts off to bring down our carbon emissions in the healthcare industry. That's my goal, that's my mission, and that's our climate committee mission at the hospital.
Great, thank you. Well, y'all, we have a great panel here. I mean, years of experience, lots of ways. The thing I'm taking up from this too is a lot of us didn't, want necessarily to work in climate or didn't seek that out, but it sort of came to us, right, through patients or through the work that we're doing or information we learned. We sort of found ourselves at this intersection. Gaurav, I want to turn to you. I talked a little bit in very vague terms, and I know there's a number of statistics around, this is how climate change is impacting our health, but it can be hard, I think, for us to conceptualize it, right? To say, what does that look like in real terms? We heard a little bit from Dr. Holder about this. Can you just tell us a little more of, in your experience as a physician, how does this show up? What are the connections between climate change and health from your patients or your own experience?
Sure. Maybe I can tell you about a patient of mine. I think, again, what you're hearing is that, we come into this, there's something very raw about taking care of people's health. My dad is sick now. I'm seeing it from another side. When we see people's health, we care for people's health, we see their humanity. We really nurture something I would say very sacred, right, about taking care of people. That's a very powerful responsibility we take, that people trust us in this space in the clinic room to take care of them. Is a profound blessing, privilege that I think we take very seriously. And early in my career, I just realized I can't wait and just sit in this clinic room knowing that patients are getting sick and harmed in society. One of my strong reactions, I want to be an excellent doctor, and I want to get out into the community and understand the structures that need to be changed so that patients can thrive in the first place. So I had a patient of mine, I told you 2018 was my Thunderbolt wake-up moment. Maybe the world was telling me something, because that year I met a patient who had not established care in the United States, had, kind of cold symptoms, was having some runny nose, cough, shortness of breath. Started getting worse where when he was lying down, he'd get more short of breath. He was having weakness. I think he thought he was probably having, a pneumonia, and came into the emergency room to just get some antibiotics. And then very dramatically, was found to have acute on chronic end-stage renal disease. And so he got basic labs, and his kidneys had totally shut down. He was young, he was healthy, he was an immigrant from El Salvador, where he was a sugarcane farmer, and it really baffled the hospital team. He was emergently dialyzed and taken care of, and then later established care with me in primary care. A whole other story. He was really scared of whether he would get care in the U.S. healthcare system. And I could just remember how scared he was of, like, will you help me get care? We said yes, and but of course a great deal of damage had been done. And usually you wouldn't think of a young healthy man having, you think about blood pressure, high blood pressure, diabetes. He didn't have any intrinsic kidney disease. And after a really thorough evaluation, he had this thing called CKDU, Mesoamerican nephropathy, heat-triggered renal disease. And so what I feel confident telling you today is that him being a sugarcane farmer out in the heat in El Salvador for 15 years, he was exposed to extreme heat day in and day out. Unbeknownst to him, his body was getting very dehydrated, and he wasn't getting enough blood flow to his kidneys. And so slowly the perfusion and the oxygenation of his kidneys, the lack of that was just nicking his kidney up slowly but steadily, so that they ultimately failed over a number of years. And so now he's my patient. I see him quite often. He's a remarkable person, and resilient, but has an up and down course. So I think he has a young family. He had no reason to think this would be his journey in his health, and so of course we want to provide excellent care for him. But that is kind of the face of climate change for me. And we know that more and more cases. There are already many cases in Central America. Here in Florida, we of course need to be thinking about our outdoor laborers around the world. These folks are putting their bodies at risk by being in outdoor spaces, tending to food, right, so we can all eat, providing these basic resources for society. But are we putting the appropriate occupational rights in place so that these people can be protected? We saw what happened in Phoenix last year. We see what's happening in Miami every year. And honestly, a lot of that is very invisible. We come home, we cook our dinners, we go about our lives, but who are those people that are putting that food on our table, and how much does their health matter to us? And so that's what we want to speak up for.
Does anyone else want to just comment in on that? Any other stories that stand out to you in terms of the face?
I have a similar kidney stories, and unfortunately last year we had a worker collapse in the fields in Homestead, and he didn't survive. And his was acute heat stress. So we know definitely it impacts you directly, and that's when the heat illnesses and all the extreme weather events, that's impacting all of us. Just watching those news day after day of seeing when the wildfires and the storms and the flooding, that is impacting all of us now psychologically. But directly for the people in the path, that's the direct impact. But then indirectly, the cause of it, and that's the population I've treated for the last 40 years, have been the indirect ways. All that pollution, when you look at the communities that are placed next to the polluting environments, the polluting industry, the highways, are your low wealth people who had little power and were forced to live in certain areas. So I link things like COPD, chronic obstructive pulmonary disease, the worsening asthma, the cancers that I see. That's all indirectly related to what we've done to our planet from all that pollution. Microplastic. You saw the recent data on microplastic. It gets into your arteries and causes more inflammation. Our particle 2.5, those tiny ones we can't see, they're penetrating our lungs, penetrating our brain. They go to the placenta. Tremendous amount of impact directly and indirectly. And of course, the anxiety and the heat itself and the anger and the interpersonal violence that increases with that. So tremendous amount of health impacts. It's everywhere, everyone. And unfortunately, it's worse for some.
you. Well, and I think both of you just speaking are just a testament too to the role, I think, of health professionals. I mean, I'm looking out in this audience for those of you that are thinking a lot about how to communicate the severity and the impacts that climate change is happening right here, right now. I mean, health professionals being on the front lines and the stories of what they're seeing can be so powerful, putting a face to that. And there's been a lot of talk about narrative and how to approach this. I don't know that either of you actually said the word climate change in what you just shared. I just think that's interesting, right? We didn't actually say it, but very much came through as sort of a through line in those stories. Dr. Holder, I want to just turn to you too in your role with the FCCA, the Florida Clinicians for Climate Action. We don't usually think of health professionals as being in this kind of advocacy role or doing some of the work that you're leading. We think of them in clinicians treating the patients, and there's that. But can you talk a little bit about what the role of health professionals is in advocacy?
Well, I have to give it to our nurses. They are number one in every survey of the most trusted health profession, and then doctors and pharmacists. But nurses, doctors, pharmacists, what does that tell you? We are trusted. So if we can give the information in clear, concise manner that engages you to realize what is happening to our planet impacts you and what you can do about it, I think we can get that movement because it's an urgent response. So being trusted messengers, and the most valuable thing in this world is your health. When you're younger, you don't realize it. When you get to my age and you start realizing this is your wealth, is your health. And so what else can we do but being the doctors? 22 million health workers. If each of us really take that responsibility to bring our communities and bring our society together, we can make that move, whether we do it through voting or we do it through personal changes, but really to get that movement to get our societies to protect the rest of the planet, because there are more than humans on this planet. Amphibians, 90% could be extinct. So there's so many areas that the physician has a role. And what is health? And that's where we said, Mr. Weigel from AstraZeneca, we are moving to green patients. We're moving from a sick model to wellness. If you don't embody what wellness means as a physician, how could you make your patients well? That means we have got to be advocates. We've got to be sounding that alarm as loud as possible and giving the information and motivating folks to act.
Thank you.
Please.
Just an addendum. The majority of health professionals are clinicians, meaning they see patients, doctors, nurses, others. But there is a subgroup of us who explicitly take a population perspective. This is public health. This is the public health side of the health professions. And in this advocacy role, and it's advocacy at the community level, but it's fundamentally advocacy at the policy level as well. And you need both. And it's national and very local, and it's global at the same time. But for public health professionals, this is exactly the core. It's trying to anticipate what are the risk factors, the upstream risk factors that we need to act on so that they don't end up showing up in these dire circumstances. And without that, no health system is sustainable. The other thing that public health does is analyze how do you structure a health system that's efficient and sustainable from an environmental point of view. You mentioned the health system itself. It's the largest sector of the economy of this country, and it's the second largest sector of the global economy. It is one of the biggest contributors to all kinds of pollution, radiological waste, biologically active waste, and it's a major contributor to the factors that lead to climate change, as you mentioned. So we also need to see how our health system is structured so that it is not itself part of the problem instead of being part of the solution.
Could I just add one thing to the policy point? I really believe in this, that, that policy is our most potent tool to transform, right? And, I do some advising for our governor's office and some task force for our mayor and City of Cambridge. I'm struck at how rarely health professionals are in those spaces and how really powerful decisions are being made without someone representing our patients. And so our patients should be in those spaces, advocates, but also those of us who are trying to navigate, who are facile with the data, bringing the best data to bear so that we can use science-based, equity-oriented solutions. It really, I was in building codes. I was like, how did I get into a building codes hearing here? It's a primary care doc, but these things are, if we don't get those things right, there's no way we're going to bend the arc of this stuff. And we run a fellowship now teaching health professionals how to develop advocacy skills. So we teach a little bit about how climate impacts health, but mostly we train them in advocacy skill sets so they can do community-based projects. And what I'll say just really quickly is that what we found is that these doctors, nurses, social workers who want to get involved in community-based practice, they feel so overwhelmed with their day-to-day practice of taking care of patients in a pretty dysfunctional healthcare system. There's a major burnout happening in the delivery of care right now. And there's a yearning. There's actually 96% of Harvard medical students expect climate education in their medical training. There's like a sea change happening of health professionals really craving to get involved in this. But then they feel despair and overwhelmed and they don't know how to get involved. So, we need to be, we need health professionals be a part of the public conversation, of the policy discussion, and we need to give them time and space and the tools to be effective in those roles, because I really strongly believe that that's how we embed health policy into climate policy.
Yeah, FIU and medical students are also very much like your Harvard students, because FCCA, we have a practicum for medical students, and we bring them in and they can be trained how to learn about climate change and health and advocacy. One of your medical students, An Lee, wrote a heat advocacy and malaria. Our FIU College of Medicine students, they have written 2 op-eds in Invading Seas, and we give them the guidance, and we also develop clinicians to do the same thing. And definitely the clinicians and the students are all ready to get involved in this work. Of course, time, but if you develop the resources and the support and the structure, it's so much easier to get folks involved. And that's what the climate action across the country, and there are about 32 of us that are developing to be able to allow clinicians to do this.
That's great. And I know, Dr. Frank, I'm sure you think a lot about this too, being at How do you think about preparing the next generation of health professionals, right? What is the role of that skills and development to think about the next generation of folks coming through?
Yeah, I've been thinking a lot about that before coming here. I chaired a commission in 2010, 100 years after the Flexner Report, which established the way we teach medicine, and then also other health professions. And but we updated that just in 2022. We had an international conference here in Miami on the education of health professionals after the pandemic, because the pandemic really disrupted both the healthcare and the educational sectors in a major and long-term way. And so anyone who's interested, it's one of the November issues of the Lancet in 2022. There's a lot of detail. But one of the main conclusions is that the world is, health systems are becoming more complex, and the societies in which they operate are becoming more complex in every dimension, environmentally, but also politically, socioeconomically, in terms of interdependence and connectedness with other parts of the world. So today, health professionals, as we educate them, it's not enough to allow them to master the technical content of their practice. They also need to understand the context. So content is no longer enough when you educate a doctor, a nurse, or any other health professional. Context is as important. The organizational context, so that we may become advocates within our own organizations, that we are not polluters and contributors to climate change, and obviously the societal, the community context. And that requires a very different type of education. It is mostly a problem-based, interprofessional approach based on educational outcomes rather than the way we typically measure education, which is through the inputs, how many hours you stay sitting in a place and how many exams you can pass. It's a competency-based and based on teamwork, and realizing that today there's a large array of non-health professionals who work in the health system, because the health system is the largest. So the largest employer of lawyers, for better or for worse, is the health system, directly and indirectly. The largest employer of data scientists. of course, of managers. It is the largest sector of the economy. And we need to make climate scientists part of those teams. And we call that trans-professional education. So we need interprofessionals so that doctors, nurses, public health people who are working with populations get educated together so that they can work as teams once they know how to work as teams once they graduate into the and work in the health system. But also we need to reach across all the other professions who were not trained as health professionals but work in the health space, including people who can understand elements of urban resilience, of design of facilities, so that they are ecological scientists who can assure that the health system itself is sustainable, and that our students, as they become practitioners of, as clinicians or as public health professionals, have the competencies required to anticipate the problems. We are seeing an incredible surge in our schools of physicians who are now graduating simultaneously with an MD and an MPH, a Master's of Public Health. They are becoming hybrid professionals, and that's exactly what we need, much more flexibility to address the growing complexity both of the health system and of the society in which those systems operate.
The whole point of this place is to break our silos and to open the creative juices, right? And it's been so fun to be here the last few days. A message we're always telling, I think, doctors and health professionals, public health nurses, is, hey, you don't need to be a climate scientist. You don't need to know how to run a public transit system. You don't need to know how to make a solar panel. There's people who knew how to do that. You don't have to be an entrepreneur. So we're often saying, get involved. You don't have to be, you have to be, your public health medical person and jump into this work together. I would argue to all of you out there who are doing all those other works and other disciplines, bring us into your work too. You don't need to know the medicine and the public health. Our job is to tell you that 60,000 people died of heat-related disease, heat-related deaths in Europe in 2022, that 5 million people die every year from air pollution. Explain what particulate matter does to our brains and our lungs, what gas stoves, et cetera. That we live and breathe that stuff. That's, kind of our bread and butter. That might feel hard to penetrate that knowledge base for, because you are all doing amazing work. But I think our message here is that health has really got to permeate all climate solutions, right? It's really at the heart of it. It will create urgency. It'll create clarity of mission. It is effective in making change. And so I'd really encourage everyone in your work in all your fields to bring a health lens into that.
That's great. And just the role of health professionals, I think, is so key. If we take nothing else away from this, the role of health professionals. There was a recent Commonwealth Fund study that said 80% of the health professionals that they surveyed said they care about what their health system is doing on climate change. So there is interest, there is motivation, it's being taught in curricula. We're seeing the wave of interest. Elizabeth, I want to turn to you because we've touched a little bit on this, the role of the healthcare sector itself as an emitter. And we know, just to sort of put it very concisely, we're in a sick care system, not a healthcare system. What are some of the solutions that Jackson Health or that you've seen around the country that are sort of the solutions for healthcare in addressing its own emissions?
Well, there's a lot of great work that's being out there with different healthcare institutions with solar powered roofs or EV charging stations and so forth. Some of the things that we undertook was, first we created with some passionate healthcare professionals the committee, and along with that we created working groups to address, like the waste in the OR or greening the OR and transportation. The procurement section was huge at our hospital. And then we also partnered with some organizations to get a baseline of what our carbon emission was. That was huge, to find out that our carbon footprint was large, mainly, from the supply chain. And, we started off with the low-hanging items, such as removing styrofoams from patient care areas or installing EV charging stations. As we gained more confidence, we started addressing our scope 3s, supply chain, because most of the waste came from that segment, from cradle to grave, from the manufacturing of items to transportation and waste. So we are closely working with our vendors to see what climate-friendly equipments or medical supplies that they can produce, working very closely to see, to make sure that whatever items that they're selling to the hospital is climate-friendly. So, this is how we garnered our climate committee to move forward. And one of the initiatives that we have undertook is the regulated medical waste. For those of you who are working in the hospital system know that the red bag waste is tremendous. We have the regular waste, and then we have the red bag waste, which is where we put all our medical waste, such as our bodily fluids and so forth. But however, the red bags were used inappropriately. We would see pizza boxes and paper towels. It's pretty toxic, right? But unfortunately, these red bags are, circulated differently. They're gone through autoclaving, and it's costing the hospital a lot of money, and it's costing the environment. So we decided that we need to change this practice. So we installed these holders in patient care areas. So as the healthcare professionals were doing like a procedure or they're anticipating some bloody stuff, they would go to these holders and bring out these red bags. So we really have saved the hospital quite a bit of money, and that's something that I wanted to address. We need to have administrators and leaders and CFOs in these type of meetings as well, because money talks. And if you can see the amount of money that we have saved the hospital through small initiatives, start off with the pilot programs. We just started small with some of the patient care units, and we expanded throughout the hospitals now. And when the CFO saw the numbers, they were very happy. So we are continuing, we're saving the environment and we're saving the hospital money. So start small, get some healthcare, passionate healthcare workers, to drive this journey. I'm a full-time nurse practitioner at the trauma center. This is a voluntary job. We don't have a sustainability office department at our hospital. But if there is passion, there's definitely, you can put a dent in some of the things that we are seeing, like they mentioned about all the waste that we're seeing in the healthcare industry and bring down our carbon emissions.
That's great. And folks in the room might not realize, too, that Jackson and AstraZeneca as well have made significant climate commitments. There is a White House HHS climate pledge that more than 130 health organizations have signed, committing to reducing their emissions in line with the Paris Agreement, and also build resilience. So there's health sector action, there are solutions through waste reduction, through a lot of other really innovative work that we're seeing, solar panels on roofs. We're seeing rooftop gardens at hospitals that are then being used to write prescriptions for healthy produce to patients, or being used in the hospital cafeteria, right? We're seeing really interesting collaborations with suppliers. I'm thinking of one example from Kaiser Permanente. They worked with their supplier to reduce the amount of plastic packaging in the wipes that they get. The disinfectant wipes went from a hard plastic, if you can picture, the tub of wipes, to a soft plastic, which also saved transportation emissions because you can pack more into the truck. So really innovative stuff happening in the healthcare sector. I want to turn now to you all. You've heard from our experts. I'm sure you have a number of questions. I'm going to remind folks to keep them questions short and to the point, and make sure it is a question. I will not hesitate, unfortunately, to interrupt if we go on, because we're limited on time. And I'm going to take 3 at a time and then turn to our panelists. So let's start here in the front. And I think there's a mic if you just want to wait a minute. Yeah, there you go. Thank you. There you go.
Given that healthcare professionals are so busy and so overworked and so stressed and all the things that you have already said, is there an appetite, is there a possibility that there could be a collaboration with organizations that are doing the kind of organizing work around these issues that need, and that we can pull in a healthcare professional to come in on Friday at 6 p.m. at to talk about health, because maybe you know, I mean, there's a lot of different approaches for, you know, what's important to people, and so the question is there a possibility of that, and if so, how do you see that manifesting? If I had an organization and I wanted a healthcare professional to come and speak to an audience, what do I do? And if that doesn't exist, should it exist? And
That's a great question. Thank you. Let's take two more. I saw one in the corner here in the white shirt. Yeah, please.
Hi, my name is Fatu Cisse. I actually graduated from the UN Public Health Master's program just last year. So, yeah, thank you. Thanks, y'all. But currently, I'm working for AMREF, and we are a African-based NGO. We're actually the largest, and we strengthen health systems in 42 countries across the continent. And right now, we're exploring the intersection between climate and health. And most recently, we were able to collaborate with the Rockefeller Center and with Wellcome Trust and for COP28 to come up with the African climate health agenda, and we were able to mobilize 25 ministers of health as well. So it's been a bit challenging, but being that you've all of you have worked in the global space some way somehow, I guess my question is, sorry, I wrote it down. My question is, so institutions are finding it very challenging to find a direct link between climate and health. So hence, like the not prioritizing global climate and health as well. So how can we overcome this challenge and then go more towards mitigation? More towards adaptation rather than mitigation. Oh, I'm here with our CEO as well, Bob.
Great. Great question. Thank you. And then let's take one more over here, right over here at the end.
I'm just wondering your all's thoughts on climate migration globally and how that will impact healthcare needs and the delivery of care.
Great question. So I'm hearing a lot of themes here. We got climate migration, overcoming some challenges around global and climate and health in the global agenda, specifically around adaptation and appetite for health professional activation.
I can start with your question, and then everyone pick up. There are what's called Clinicians for Climate Action throughout the country. There are 32, and they're also the Physicians for Social Responsibility. In FCCA, that's what we do. You can contact FCCA. We will have speakers, and we can help do that. Our main goal is to educate clinicians, so we have a whole CME program, and we do a lot of training of clinicians around this so they can do the talk. But what we really push is that it gets integrated in your assessment. Like I said, when the patient shows up and tells me she needs a light bill assistance, that's not just a social problem that she spent her money too much and couldn't pay the bill. What it is an energy burden issue because the climate is too hot, the light bills are high, it's too much of her cost of living, and to do medication, food, and pay FPL 10% of your bills. So it becomes a climate change issue. And if you incorporate that in your assessment and plan, as you take the patient history, you should be able to integrate the plan in that you're gonna get a social worker, you're gonna learn how to get weatherization, you go to the social worker, that's why it's interprofessional. So on an individual patient basis, yes, we need to learn how to do that as physicians. And that's where you see the change in how we're now teaching medical students, where the context matters and the patient, the social determinants matter. So that's where we're heading. But in terms of the role of the physician being the expert to come and speak, that's being developed throughout, and most universities have it now, and the different organizations, you can Google them in your state, and you'll see doctors who are training more and able to do that. So we've come a long way.
It's also part of the nursing curriculum now, slowly starting. So you can also contact the Alliance of Nurses for Healthy Environment for speakers to come in. as far as the social determinants of health is part of the emergency room assessment tool. And I think there are some hospitals where the physicians are prescribing if the AC is broken at the homes to have AC to the owners. They have to install those. So it's part of the assessment and when the patients come to the emergency room, the environment that they're staying in. So, you know.
Can I speak to migration real quick? This is one of the first things I think about at the intersection of climate and health equity. If it's too hot to where you live, your food's not growing, your water's running out, that is causing and will continue to cause great migration. And frankly, we haven't put our arms around the scale of what that really means. I mean, I think it's one of the big global challenges we face in the midst of the climate crisis. And so I think about gender-based violence during migration. I think about infectious diseases. So there's all the health impacts of the act of migration. And of course, we know migrant communities are in a very vulnerable situation, whether they're internally displaced or externally displaced, and the health consequences of that vulnerability into the long haul. So I'm actually speaking at the kind of asylum immigration conference for the first time this summer, and they said, hey, our community hasn't really thought about climate in this. Can you come speak? And this is kind of the interesting thing to me. I think they said, migration and asylum is such a complicated field. How do we get our head around the complexity of climate change? And I said, it's the exact opposite. To mitigate all the challenges of forced migration, the answer is really simple. We have to stop burning fossil fuels is one ingredient to that. So you could say it's too hard to get our head around the complexity, but in some ways, the prescription, the solution that is a potent force in supporting the efforts of working on migration is these inputs of how to protect our planet. And of course, that's not simple. But we can bridge those spaces, and we can have those communities kind of advocating for climate solutions as a part of the critical work of migration and the health implications of that. Maybe I'll say a quick word to your point of how to bring health professionals to the work. We're doing work with like the EPA, with the governor's office, where they have a very specific question. We're trying to get diesel trucks out and get clean trucks in. How many lives would be saved there? So there's often a research question, there's a medical question, it's almost a consultation. That's often a nice model, going to your local institutions, they'll find you the person, say, hey, we're trying to understand how to measure this or how to communicate this. I think our public health, medical, institutions really need to play a role in supporting community organizations of other organizations doing this. So keep asking your local institutions, and there should be health professionals who are ready to plug in the way that you're describing.
I wanted to address the question of my alumna and now colleague, public health colleague, because it's an excellent question. Globally, I do find sometimes that there's a zero-sum game, especially among advocates. People think that if money allocated to global health is allocated at the expense of money allocated to climate change and vice versa. And that's the wrong way of thinking about it. But it is, a very common assumption, because and our thing, our job is to connect the two. When you ask to people, climate change sometimes sounds a little bit remote. It's about fossil fuels. It's about energy policy. You need to bring it to the level of the impacts on communities and people. And the most important impacts are health-related impacts. They're inextricable. When we talk about a warming planet, it's the heat waves, the heat strokes, the heat-related, which we've heard. When we talk about the changing ecology of insects, it's the insect-borne. You're in Africa. A lot of capitals in Africa were built at a certain altitude to avoid malaria. Malaria is showing up there because now it's warm enough to have the mosquitoes and all the other vector-borne diseases. When you're talking about the impact on food supply, it's undernutrition, it's a starvation. We have to get the conversation from the more abstract stuff related to energy policy and to get it to the human dimension. And when you get it to the human face of climate change, it is all related to health and poverty, which then get people and families into, and migration into multiple vicious cycles of downward spirals. So, but it is an urgent task, and it has to do a little bit with what you said at the end. How do we start investing? We need to invest in mitigation and address the source and cut down carbon emissions. We also need to invest more in adaptation, in resilience, and that is a imminently local work that needs to happen. Because even if tomorrow we eliminated all emissions, a lot of the harm has been created. And then we need to connect climate change, which is an abstraction, to very specific health threats. Pandemics and climate change, which just came out of a pandemic, have the same root cause, which is unsustainable ways of relating to the environment at the expense of other species and our own species. Pandemics are as anthropogenic as climate change. We think that because it's a virus, it's natural. It's not natural. It's anthropogenic. It's the way the food industry creates these conditions and the food commercialization of promiscuity between humans and other species that allow, these are all diseases that begin in other species and jump the barrier and come to us, and we're unprepared. So emphasizing the commonality of a lot of health problems like pandemics with climate change is the other way I would suggest. But I think you really put your finger on a very, very critical task we have ahead.
And there's two pieces I want to pick up on with that too. One is you mentioned, that the health impacts of climate change are so strong, and we're seeing that messaging come through. At COP, there was the first ever health day, right? We're starting to see these connections, and the things that you all know very well and have seen firsthand. We're starting to see, this is a compelling motivation, a message for folks to act. And the other piece I just wanted to mention on the point of adaptation, we were talking yesterday in the roundtable. Healthcare is doing a lot of work to raise their buildings, and they're becoming more resilient. But if the roads are flooded and an ambulance can't get to the hospital, have we really solved the challenge of healthcare access during a disaster, right? So, thinking about the role of healthcare as part of a larger ecosystem and playing a role in that collaboration is so key. So we're wrapping up here. I'm going to ask one final question for each of our panelists, which is just, we've talked about a lot today. I know our brains are full. We're on day 3. It's like we're at the end here. What one message would you leave this audience with today?
Look, I've just embraced, I'm kind of informed by my immigrant grandparents and the lives of my parents. Like, the world feels impossible, and we can make it possible. Like, under 5 child mortality is just descended over the last 50 years. Literacy has skyrocketed. Things that never seemed possible are clear and present, and making, in some ways, public health has never been better. And when I look at the scale of this challenge, it frankly feels impossible. But I think, a message during these few days is courage, and knowing that we can make that possible, and things that seem impossible with courage and determination actually all the time do become quite possible.
My final comment or key message is that we need to connect the dots. We often act in very, very isolated ways. We need to connect the dots among health professionals, connect what happens in the clinic to what happens in the community, in the population. We need to connect the dots across problems, like the previous question. Climate change and health crisis are intimately linked. We need to connect the dots between the local and the global. We need to really adopt a global mentality. Everything is ultimately local, and everything is simultaneously global. And if we don't connect those dots, we're not going to be effective. And most of all, I see this in my university, we need to connect the dots among areas of expertise and advocacy, break out of the silos. That's why we created the Climate Resilience Academy. The academy in the sense of a convening body. It's not a new structure. It's a functional arrangement, like the National Academy of Science. You bring all the assets that the university has in our marine school, which is one of the top climate scientist groups, with our School of Architecture and designing urban resilience, to engineering with new materials, to medicine for all the health implications. That is the only way we're going to address these complex challenges. I am optimistic, but every success in human history has come from collaboration. It doesn't come from developing silos. It comes from collaboration among disciplines, among countries, among communities, among professionals, and among community organizations and universities. So connecting the dots is my final message.
Ditto everything, but I want to bring, I guess for me at this point, my patient Jorge, who shows us what it is to have meaning and have value in everything you do, because it's within that meaning and value that you can persevere and do this for 40, 50 years and know that in the end, we are going to find the solutions that save many lives and do it urgently. Because he goes, rain or shine, cold or heat, I gotta work. But he wanted us to know, and he did an interview with NPR, because he was one of these vendors who you sell oranges on the streets in Miami. If you're around, they're always selling. They're undocumented. They have bags of limes and oranges. And his kidneys got worse, and his skin got weathered, and his malignancies and everything else. But he had a firm belief in people, and he volunteered to show us his house, which was a concrete block about 6 by 5 on a concrete platform, which was so hot. But he took the time to say, come into my life and let me show you how I can love, how I see meaning, how I see hope. And my patients survive all their crises because they have the meaning and the value, and they share the love of the community and the people, so they continue to fight. We are going to find a way to save many lives, like we've done with AIDS and measles and everything else. So this is just a passage of what we do as humans. But if you don't find that meaning and value and understanding of why you do this and why we live, you're going to really you're not going to keep fighting. You're not going to fight for your cousin. You're not going to fight for Julio. You're not going to fight for Jorge. You're not going to fight for all my patients that I fight for. And that's what we need, and that's what I leave you with, Jorge's message. Thank you.
Sorry. Hospitals are not only taking care of patients, but it's also run as a business. So I wanted to quote the famous Canadian environmentalist David Suzuki, and I wrote it down because I didn't want to miss his quote. Economics and ecology are derived from the same Greek word, oikos, meaning household or domain. Ecologists try to define the conditions and principles that enable a species to survive and flourish. Yet, in elevating the economy above those principles, we seem to think we are immune to the laws of nature. We have to put the eco back into economics. So as healthcare professionals, we have an obligation to our patients, to our community, and also to address our climate impacts, our climate footprint into this world, in the world that we are living. And we need to be passionate about it. We need to be strong advocates for it. Thank you.
Thank you so much. Please join me in a round of applause.
Thank you.